Hello Enid, I am Diana Hernandez, Public Information Officer serving you at Garfield County Health Department. And if we can pull up the slide, I want to take a second and talk about Garfield County region, geographic region for the Oklahoma State Department of Health. And so what you see on here is the bright blue is Region 2. So Garfield County is one of 8 counties that make up Region 2. Region 2 is part of 10 regions that cover the whole state of Oklahoma under the umbrella of Oklahoma State Department of Health. And so we share a unified mission, and that is creating a state of health for Oklahomans. So if you show the second map, we have done some transitioning recently this month. So Jan Fox, our Regional Administrative Director, was designated Deputy of Health and Preparedness this month, which opened up that Regional Administrative Director, and I'm happy to announce that our Enid native and our own Maggie Jackson is interim Regional Administrative Director. So thank you, Maggie, for being here and being so awesome.
Thanks, Diana.
So we're going to take it back in time just a little bit. We just had Christmas holiday, which is a high gathering and traveling holiday. Then New Year's, which is another high gathering and traveling holiday. Throw in Omicron. So that's a cause there. And then we see an effect, which is the surge of COVID cases. So I have a question for you, Maggie. What are some COVID numbers right now? And what is the Garfield County Health Department doing in this surge claimant?
Sure. We've got, it's a little hard to see, but you can see at the end of that line, we've had a large spike in COVID-19 cases. There are lots of people testing positive throughout the state, and we are not an exception. We have about 1,386 active cases right now, which is much higher than where we were in the fall. And we're still seeing that averaged about 135 people every day are testing positive in our community. But if you can see the very right side, our total deaths are at 219. It's still a lot of lives lost from COVID-19 here in our community, but we are seeing a decline in how many people have died from COVID. So we're encouraged by that. And that's something we're learning, that the Omicron variant is very, very contagious. It is much more contagious than previous variants. Lots of people are becoming infected, but they are not becoming as severely ill, and we're not seeing as many people dying. So that is a good thing. So we have had a lot of more people seeking testing, and you might have had a COVID test recently, because thousands of people in our community have needed a COVID test lately, and many of our providers are able to give those tests along with an appointment. So if you wanted to rule out flu or strep at the same time, those tests are available through providers. But at the health department, we offer free COVID-19 tests. So we have the PCR test, which goes away to the lab. There was such a big demand for those that the results were taking sometimes 4 days, sometimes depending on the time. But they have caught up, and I think results they're supposed to be coming between 24 and 48 hours. But we also have free rapid tests at the health department. So the rapid is a rapid antigen test, and so they are best to get when you have symptoms. So if you have those symptoms, we'll look at those later, we offer those rapid antigen tests. So we expanded our hours, and I love Diana included this picture, and those are our awesome nurses, and they have been working so hard. So I think is that Travis and Carissa and Anna, and we just, our whole staff has been helping with testing, but they got this shot out in the cold, and they've been providing those tests extended hours. We did have some Saturday appointments, and we will stay a little bit later this evening. But you know, we are starting to see a slight decline. The cases surged, and we think that we're kind of over that tipping point. So we'll have testing available all next week as well if you end up needing one. So you can make those appointments. The website's right there at the very bottom, or we can link it on our Facebook page as well. It's osdh.metech.com. That's how you book an online appointment. Or you can call 233-0650. So a lot of people didn't know that we offered free rapid tests. So we want to remind you of that's something that we will continue to make available. We also are continuing to provide vaccinations. So this is, something we've been asking our neighbors to do is get their COVID vaccine, because what we're seeing now, the weekly epidemiology report showed that people who have the booster of the study looked at Pfizer, but the boosters are really what is reducing the risk of severe illness from this recent COVID-19 surge. So we do have people testing positive after being vaccinated, but the data is showing us more and more that you are much less likely to become severely ill and go to the hospital if you have that vaccine and a booster. So this is a chart of the vaccines that we offer at the health department. There are other providers in the community, Walmart, pharmacies, Evans, and our hospitals as well. So you can get a vaccine at a lot of different places. We have all of the brands available at the health department by walk-in. We ask that you walk in before about 11:30 or 4:30, because after you get your vaccine, you have to hang out for a little bit and make sure that our nurse can observe. So we ask that those walk-in times, you give us a little time before we close. And the newest news is that there is the opportunity to get a booster or fourth dose of the Moderna vaccine. And Pfizer has not yet recommended an additional booster, but Moderna, it's within a 5-month time frame. So if you have questions about that, when you call, you can call our county health department, or if you walk in for your appointment, we can talk you through your options for which vaccine you could receive or which booster you could receive. So, did I miss anything on those boosters?
Nope.
Yay, good deal. So come on in, and get a vaccine if you have still, ask questions. We want you to come get a booster.
Awesome. Okay, so what if you wake up in the morning and you're just not feeling 100% and you're having symptoms, but you don't know which symptoms to really start worrying about, or if you're wondering, when do I need a COVID test? If you look at your screen, we have 8 symptoms. Now, these symptoms are a fever, higher fever than usual, sore throat, cough, difficulty breathing, and a sudden loss of taste and smell. These are A symptoms, and B symptoms are nasal congestion, stuffy nose, chills. So it is recommended that when you have one A symptom, get a COVID test. If you have 3 B symptoms, get a COVID test. So this is kind of like a chart that you can kind of glance at from time to time when you're not feeling 100%, and to just kind of do some self-monitoring. Speaking of COVID tests, you can actually order 4 free COVID tests. Now we have the link provided here, but check out our Facebook page, Garfield County Health Department. We also have it posted on our page. This is an opportunity for you to get up to 4 free at-home COVID tests mailed to you. It'll take approximately 7 business days to get to you. Another thing to keep on your radar are N95 masks. Now we will start seeing them roll out sometime next week. They will be at your local pharmacies, Walgreens, CVS, Walmart, even local medical groups. And you will need to pick them up in person. So if you want to show the next slide, you will need to pick them up in person, but the logistics are still being figured out, and we should have something by the beginning of February to share with you guys. So other than that, is there anything else that you want to share, Maggie?
Sure. So on the N95 masks and the symptoms, we are seeing that the Omicron variant, it acts a little bit more like, for those less severe symptoms, they feel like a cold. So we're encouraging people again to be tested, and that is because you could spread COVID-19 to a vulnerable family member or person at your office without knowing that you have it. So if you're questioning why would I get tested, that's why. We just know that we have people catch colds in the wintertime. That happens, but this virus is still putting our vulnerable community members at risk of going to the hospital and potentially dying. So that's why we ask you to get tested, and why these at-home tests are a great resource. They don't always get reported if you're taking that test at home. So we recommend if you have symptoms and you do an at-home test and your result is positive, that is a very accurate result. Trust that result. It is correct. And please stay home. Follow the isolation guidelines if you get a positive home test. So if your test is negative at home, those antigen tests are most effective with symptoms and sometimes later in the course of the virus, in the course of infection. So if that test is negative, we recommend you follow up with a PCR test to double check. But if you have symptoms and you get a positive result, you can trust it. They're very accurate. And when you maybe see them advertised online, we just suggest that you go to a source that you trust. That's maybe a name. It's not maybe someone you don't recognize on the internet. They could just be, some false advertising. So we just, places like Walmart, Walgreens, places you would order other medications from, just make sure you get them from a reliable source. And we just want to encourage you guys as we continue throughout the school year that you would stay home if you're sick. I mean, we don't want to have strep throat. We don't want to have all these other illnesses. And at our office, we're encouraging people, please stay home if you're sick, because if it is COVID, we don't want to spread it to our vulnerable coworkers and schoolmates and teachers and things like that. So if you're waiting for that result, for that PCR result, and you are experiencing symptoms, please stay home and isolate. And we did have that recommendation change that it's 5 days of isolation if you have a positive test, and if you are then if you still have symptoms, stay isolated for 5 more days. If your symptoms improve, then you can wear a mask and go out, within precautions with your mask on for the remaining 10 days after you test positive.
Awesome.
Yeah. Thank you.
All right, and that is it for our community health update. Do you have anything else that you want to share?
Oh, just thank you for tuning in with us, Enid. It looks like we're on the downturn of this surge, so I hope you are staying well, and hopefully we will warm up and get back to school tomorrow. And hope you have a great rest of your day.
Awesome. Till next time. Bye.
Bye.